Hello, and thank you for joining us tonight for our free webinar, Modern Cupping Therapy, Intro to Lift and Release Technique, featuring Shannon Gilmartin. My name is Jeff Bloom, Education Marketing Manager here at LASA OMS. For over 40 years, LASA OMS has been striving to promote the growth of the acupuncture industry by providing quality products, great prices, and the best customer service, as well as supporting the many schools and continuing education efforts available. With our free webinar series, we intend to provide free educational opportunities taught by some of our industry's most renowned practitioners and educators. I would like to take a moment to acclimate you to the webinar room. To the right of the video screen, you will see 3 tabs: Chat, Questions, and Polls. To chat with other attendees or to communicate any technical difficulties, please use the Chat tab. For questions of our guest speaker, please make sure to use the Questions tab, and we'll get to those questions at the end of the lecture. Please note that each webinar is recorded, and immediately following the conclusion, you will all receive an email with a link to view the video on demand and a copy of the slides. And you may always visit our blog and use the free webinar tag to find all of our previously recorded events. From neuroscience to sports acupuncture to Chinese herbs, you'll find something interesting for every practitioner on the LASA OMS blog. Now for our featured speaker. Shannon Gilmartin is a licensed and nationally certified massage therapist, certified modern cupping therapy practitioner, and educator. In addition to her focus in modern cupping therapy, she has over 15 years of experience in therapeutic bodywork, including medical massage, myofascial release, neuromuscular, craniosacral, soft tissue injury rehabilitation, Thai massage, and visceral manipulation. She has taught all over the US and abroad, and she practices in Virginia Beach. Shannon has authored The Guide to Modern Cupping Therapy, a step-by-step source for vacuum therapies, and she has also been published in Massage Today, Massage Magazine, and online interviews with Bodywork Buddy, The Donna Sebo Show, and The Juice Guru. Please join me in welcoming Shannon Gilmartin.
Hi, Jeffrey. Thank you for having me. Thank you, everyone out there, for joining us. As he said, my name is Shannon Gilmartin, and I am here to share with you the lift and release technique and introduction to it. I have been, like he said, a massage therapist, well immersed in the world of bodywork since about 2000, and working as an educator and cupping practitioner since 2004. I love everything about cups, and I was very honored a few years ago when I was asked to write the book, obviously titled The Guide to Modern Cupping Therapy. And one of the biggest takeaways is the technique that you're going to learn today. In our courses, there are so many adaptations and modifications of existing cupping knowledge, and we really have so much information to share with you. So let's get started. Excuse me. So as we get into anything with cupping, I always love to just at least pay some respect to the history of where it comes from. With so many people around the world having some kind of knowledge of cupping, it's fun to at least, again, pay that respect to where it comes from. Before we get into more advanced techniques like you'll learn, we do talk about some of the traditional well-known cupping techniques tonight, and how the lift and release can be not only added into those for betterment, but also how it is a standalone. So thanks the world of cupping thus far. Our company does have a lot of emphasis on 2 major objectives for the education of cupping, massage, and bodywork. Firstly, it's important that we all know and understand the physiological effects of cupping on the human body. So we do have a lot of science and a lot of ways to really help you understand what cupping does for the body. And also, as an educator, we want to make sure that you're learning how to optimize the therapeutic results of cupping bodywork. So our courses do have a lot of information and paperwork, many, many pages, but there's also lots of time of hands-on bodywork. And this technique you'll learn tonight is a crucial component of all of that put together. So speaking of the science and understanding what cups do, we have these 3 primary physiological responses to cups on the body, which help explain why they are known for so many great therapeutic responses. So when I did all the research to write the book, and a lot of the articles I did from all different sources around the world, there were these 3 elements that kept coming around to explain why cups do what they do. So the first response being negative pressure, you would probably say that's not a physiological response, but when the cup is put on the tissue, it does lift it and it creates that space. It is very decompressing. So the negative pressure of an applied cup to the body is where everything starts to take effect. And when people in the more recent years have been using cups, they have this secondary name called myofascial decompression. And that is absolutely crucial to getting into the bodywork world, understanding how that component is involved. So the first part of having negative pressure of a cup on the body is obvious. That's that lifting of a cup. But just like in massage and body work, with the positive pressure of your hands to stimulate the vasodilation, the release of the histamines and all the chemicals that get the vessels to dilate, the negative pressure of the cup really enhances that and makes it a very quick response. The hyperemic reaction in people with cups, you can see them turn red immediately because the vasodilation allows for the third component, the enhanced fluid exchange, to be more easily accomplished. The increased circulation that we'll talk about in a few moments is obvious for people that are familiar with cupping, but it's also the fluid exchange. So it's blood comes to the distal distribution points, but the lymph also recedes. So it's that exchange of fluids, and it's a really powerful component to understand what cups do and how putting these three together leads to this. So trying to focus, if you will, on some tangible therapeutic potential, these elements here really get people excited to work with cups the way that we do now. Because if you are seeing cups grow around the world like we have, especially in these last 5-10 years, there's so much benefit out there, and this breaks it down. Different applications have the ability to bring about different therapeutic results. So starting at the top with encouraged circulation, most of you all, if you do work with cups, see the blood circulation, which we'll revisit again in a moment, but it's the circulation of blood and lymph and all kinds of movements in the body, whether it's chi or prana, all these energies, everything that circulates, right? So we make it move with cups. Alleviates adhesions. We do address a lot of scar tissues in our classes and just any restrictions that can cause dysfunction. You can physically see them in the cups depending on the application. Cups are known to help clear congestion and stagnation, everything from stagnant blood to cellulite and all kinds of different systemic stagnations. We'll even talk about the digestive system at the end of this presentation and the stagnation of constipation in the body. Cups are known to lift, rehydrate, and manipulate fascia. Any of you fascial therapists out there, the fluidity that is brought to the tissue and the fascial restrictions changes exponentially when you use cups. And this technique tonight is a game changer. I promise you that. Cups are even used to reduce inflammation, and there's different applications, whether it's acute or chronic. Knowing how to address the two differently, this technique, you got to be able to really use it. Cups are known to cause micro traumas in tissue, and a lot of you, if you know about the petechiae and the ecchymosis, it's not tissue damage, so we're not bruising people. And this technique, the lift and release, helps things change quickly with the less potential to cause damage, and that's really huge for people to get familiar with as they approach the cupping subject. One of my favorite, encourages neovascularization. That enhanced fluid exchange when you flood an area with nutrients, the ability to have the regenerative potential and all these internal vessels, blood vessels, even nerves respond, which we'll talk about shortly. There's nothing more gratifying than someone who is experiencing numbness or chronic pain and dysfunction. When they have cups introduced, this lift and release, especially testing and shifting and changing, does yield for these immediate results. People are feeling things when they haven't felt them in months or years. Right? Cups are awesome. And lastly, but definitely not least, one of my favorites we'll talk about when we talk about the nervous system later. Cups help to alleviate excessive pressure on sensory organs and soft tissue, which leads to a reduction in pain. And I will discuss things like fibromyalgia or central nervous system conditions and how this technique, the lift and release, is a facilitator to welcome so much change. So that shows a list of so much ideas and potentials of how cups can do so many different things to affect the body. One system at a time, we break it down, but tonight I am going to highlight a few systems for you. However, to get into the technique, it's important to revisit the fact that most of you, if you know cups, or if you don't and you're getting familiar with it, we know two. The stationary cups are most familiar with those circles and just the stationary placements. They address exactly the location you put the cup. Now, if you're an acupuncturist, you're using those cups over different points to clear the stagnant restrictions and the circulation of the chi in the body. But a massage therapist might put them over trigger points. Still, other therapists and body workers might find reflex or neurolymphatic points or any area of restriction. If it's not contraindicated, we teach you how to just put a cup on it, and that is an area of focus. So stationary cups are very versatile and beneficial depending on your scope of practice and your training as a body worker. And lastly, they are known to penetrate the deeper layers of tissue with the highest suction pressure. Stationary cups can take the most suction pressure and not cause damage. But then progressing over to moving cups, a lot of people know about the moving cups up and down the back, and maybe if you're doing cellulite work, you work over areas of congestion. But the moving cups can be used to treat general areas or different regions of the body. They address the more superficial layers of tissue because it should be a lighter to medium pressure. Because if you have too much, it can cause tissue damage, right? So there's a good reason to understand the different suction pressures and what's most safe and logical for the application you're trying to do. So for moving cups, the exception, we do affect deeper layers like the large intestines with a moving cup with different suction, but it's that lift. It's not the suction, especially in the abdomen, because it's such a vulnerable part of our anatomy. So those two techniques are awesome, right? So many of you, if you do cups, are familiar, but you know, with Modern Cupping Therapy Education Company, we modernized and adapted cupping techniques and applications to enhance your field of body work. So we have many different, but it's most important to understand, regardless of the technique, that cups should never hurt. So I love having this diagram that's from the book. It just shows how light, medium, and strong suction, regardless of what you're applying to the body with the cup, does affect every layer. So for example, maybe you're trying to get a deep, muscular, strong suction. That's great. You will grab that muscle belly and do some great muscular relief for that client, you know, but it does depend on someone's hydration, on their experience previously with body work, right? Their comfort level, maybe they have some nerve stuck in a pain pattern. So all of those layers of tissue, if someone has pain to it, they're going to proprioceptively block you from the comfort and the ultimate benefit of the cup. Just like a deep pressure with a hand or an elbow even, people wince. And it's that whole no pain, no gain mentality with body work that we just I don't even visit that, because your body has to welcome the therapy, right? So I like seeing how maybe you want to get the stronger muscles with a strong suction, but even the lightest suction will affect those underlying layers of tissue. And cups, especially, are a body work that is done cumulatively for these really awesome results. So to get all of these layers of tissue to change, it's important to use different techniques to facilitate the change you're going for and the intention of the application of the cups. So getting into this lift and release, I love showing these images, okay? So we have different layers of tissue affecting blood and lymph and muscle. When I wrote the book, we've all seen as body workers how great cups are. We see the hyperemic tissue, we see people getting red on the table, that good circulation. You hear how they feel, how their muscles are getting more pliable in your hands. But I wanted to have some tangible scientific evidence. So these thermographic images really do paint a couple of beautiful pictures for you. So firstly, if you're not familiar with thermographic imaging, it does show different colors. The darker colors show a lack of circulation or warmth, and it progresses through the rainbow up to red and even white being the most heat or circulation in an area. So when I did this for the book with the images, this recipient, she has her arms over her on a chair and she's resting there while I move cups around her back. Now, moving cups, if you've ever had them, can be a little invigorating or overstimulating at times. So the moving cups have to be made comfortable. This is where we're going to get to the lift and release. I promise, I'm progressing. But the moving cups, when you pepper in this lift and release, they get more comfortable. The tissue softens and there's no pain. So while you see the circulation increase in this demonstration, you see in the second picture all of that beautiful blood flow after 10 minutes of comfortable moving cups. That's a combination of moving and lift and release. The third and fourth picture, the third one, she's left to process, but there's no cups on her body. It shows that natural dilation and enhanced fluid exchange. So in the second picture is when I stopped using cups. The third, she's so relaxed, she lowers her arms and she's resting in the chair. So that's the other picture it paints. It's so pretty. All of that circulation's comfortable. She feels relaxed. And in the third one, as the waters, if you will, the blood circulation recedes, it comes to the surface, naturally keeps going when the cups are gone, and the circulation recedes, as she's getting ready to leave from her bodywork session, right? Look at how beautifully even and distributed that circulation is throughout her upper back. No body work, just cups, comfortable, moving combination of lift and release with those moving cups. So, excuse me. Going forward to this magical lift and release technique, what is it? It is a technique that has a plunger-like effect on the body. So we are full of analogies to help you get in your mind what's happening beyond the science. So a plunger-like effect. So think about that, the good old house plunger, right? You use it to get things moving that's clogged and congested, perhaps in some plumbing. So in this way, we're talking about a plunger-like effect on the soft tissues of the body. It helps to get the fluid exchange, brings the blood to the surface and removes the lymph. So you're washing tissues out. And it does allow for quick change. It makes those stationary cups immediately feel better and allows for that movement of the cup to be smoother, more fluid, more relaxing, less pain for the recipient. And as a body worker, when you're moving the cups, some people force it. Don't ever force the cups. This will make the cup move easier. It is, in essence, for a body worker, instant gratification. And we all know that's really hard to come by. So the lift and release helps either of those techniques be more comfortable and more effective. It can be done in the same exact location, or you can do it around a region to warm an area up. I'll show you a couple of examples shortly. We do use it. I created this term called the Morse code of cups. Because when you move a cup, let's say you're moving it, for example, up a leg or up an arm, and you hit a restriction, maybe a tight muscle, a speed bump, if you will. You use the lift and release to address it and keep moving on your line of movement. Or, for example, in the colon, never force a cup if you are moving through the abdomen. The panniculus adipose can become easily inflamed. The combination of a lift and release with the occasional moving cup as the abdomen softens is so gratifying. And we'll finish tonight talking about the digestive system. So remember, this is a great way to introduce the cups, but it's also a great way to test tissue for sensitivity and the person's comfort first and foremost. Now, how do we do it? So we're going to put the cup on the body. There's 5 key components, and I'll demonstrate on my model in a few moments. I'm going to show you myself as well. But to think about this, you want to put the cup on the body, and then you're going to grab the suction of the tissue. You lift the cup physically away from their anatomy until you feel a tension engage. And when you feel that tension engage, that's where you stop lifting. And you can hold that lift for about 1 second to 10 seconds, depending on your intention. Maybe you're trying to tone tissue or really soften something, right? Different intentions. But after you hold it, then you release that lifted tension and you let go of the tissue. So you put it on, pick it up, retain some tension, put it down, let it go. I use analogy of a jellyfish. I'm an ocean person. So you think about that natural rhythmic movement of that creature, and the tentacles that reach down can have that deeper effect in the layers of tissue, like even the nervous system, like we'll talk about in a moment, okay? So it's a really simple technique, 5 very crucial steps, and that lift, you'll see why that's so important. So tonight, considering it's got so much potential and there's so many ways we really infuse this into our training and everyone takes home with them from the course, we're going to address how this can be most beneficial with the integumentary system, the skin, the circulatory system. I'm going to emphasize the lymphatic component. The muscular system, I'm going to show on my model. The nervous system, I'll show also on my model working alongside their spine. And then the abdomen, we will show working in the digestive system along the colon's pathways. So first and foremost for the skin, I'll speak about the face tissue first, then we'll talk about the rest of the body, but we all know how cups are really great to improve the circulation, right? They do that microcirculation. So even the lightest lift creates that fluid movement. So it's important to understand how cups can improve the appearance of skin, but also the health of the general big organ that is our skin. So working in the face, for example, these are beautiful little silicone face cups, squeezy, simple. I'm just going to show you a couple of cups tonight. But working on the face, cups have a great way to improve the appearance, right? But stationary cups can mark the delicate tissue of the face, and not many people really want cupping marks all over their face if you're trying to do it for cosmetic benefit. However, moving cups are very beneficial. If you see any of this out there in the world today, you see people sliding cups all over the place. But in addition to the need for oil to slide cups, because you can't slide on dry skin, the lift and release allows you to do a lot of this stretching without releasing the integrity of the collagenal binding of the skin. Can you all see that? So it's a lift and release. Thank you, Jeffrey. So what you do is putting it on the skin is one thing. Lifting it away. Now you see my skin stretches, but it actually improves the collagen circulation. It boosts collagen and improves the tone of the skin. So a lot of estheticians, when they first hear about cupping for the skin, they get nervous, and then they get excited when they see the benefits. In one of our classes, we do the face, we do side-by-side comparisons, and it's pretty remarkable, the changes immediately. And you can use this lift and release to later facilitate that slide. And oftentimes when you go to slide it, maybe someone's got tight muscles in their jaw, right? And that can be a speed bump trying to go across the cheek. Or a different example, maybe you're working on someone with rosacea and they have all those capillaries that are damaged. The sliding can be not only uncomfortable for them, but can potentially cause more damage. So that lift and release really helps with that washing and changing. And we have major ways, specific techniques to help with rosacea. And there's remarkable differences. So this lift and release is a way to travel across the face, improve the circulation in the skin. So it's like a facial with no product, if you will. But again, it's like traveling without moving. I don't need to slide it. And a lot of these cosmetic machines you see now are just that. They're only lift and release, automated. They don't let you slide it because it just is that powerful. So Jeffrey, you do want to take me out of the slide again, please? So now if we go onto the bigger skin of the whole body, if you will, not just the delicate canvas, that's our face, scar tissue applications are remarkable when it comes to what cups can do. And again, people that get to see cupping with scars, they get nervous. But then I talk about this because when you see this image side by side, I have the breakdown of the surgery and the timing it took to do the treatment. The first thing we do when we approach any scar, beyond making sure that the skin's integrity is there, is lift and release. Not necessarily with a small cup, but it's that technique that tests the tissue to see if you can go further without damaging any of the healing process. That is always the first technique in any scar tissue application. So keep that in mind as we keep going. Now, as we get into the lymphatic components, moving that blood to the surface is one thing, but allowing the cup to follow the drainage pathways of the body. Manual lymph drainage therapists, maybe when they're working on an arm, they use their hands a lot of times to mimic the lymph movement through the flat valves that move the fluid from one point to another. If you use a cup, let me see this. When you use a cup on the skin, rather than pressing and being ever so light, you can help to stimulate those flat valves that move things along the line of drainage. But again, maybe there's a restriction along the route that's inhibiting the drainage, like a scar, like a C-section scar in the abdomen. That lift and release helps to open the drainage pathways, and when you give it guidance, you see the fluid move. And remember, superficial lymph has no direction on its own, and it moves with breathing, muscular contraction, and external therapies. This cupping to follow the lymphatic drainage is that powerful, which is why we have a class on just therapeutic cupping for lymph drainage. So speaking of which, I love, hold on one second, I keep playing with the keyboard. So talking about using cups to move things along the natural drainage and move congestions and stagnations. This is one of, we have so many favorite testimonials, and this is one of my clients, and she had a 5-week-old post-avulsion fracture come in to see me in the office. And to use the cups along the drainage pathways, addressing her entire limb, so, you know, we're working all the way from the abdomen through the upper thigh and down. When we got to the foot, we're doing light lift and release. She's obviously nervous. It's the first time someone's working on it after a fracture. You see the congestion in the tissue, but doing the lift and release, washing out those fluids, enhancing the fluid exchange, and then marching it, lift and release along the drainage pathways until it's safe and comfortable to slide. The picture's awesome because I didn't know she did this. She did this for her own proof. The top picture is the morning of the session. The bottom picture is 5 hours later after the session. So the washing with the lift and release is the only technique that I used on her foot. That whole region was only lift and release. And we were allowed to glide up the leg, move the cup where it was safe and comfortable. Lift and release is the game changer. I can't say it enough, which is why I want you all to learn this and get excited about it, because obviously I am. So moving on now, we're going to do a muscular application on my awesome and patient model. So moving over to the table, I'm going to move that there. I have a model, and we're going to talk about muscular applications. So when you get to work with cups, a lot of people are familiar with how cups, yeah, they help to boost microcirculation. They're working with the pliability of the tissue and moving with the fascial restrictions and ultimately helping with muscular dysfunctions, okay? So when you go to do these muscular applications, my model, she's a hardworking body worker and all kinds of fun muscles to receive this cupping work from. I'm applying oil because you have to have something to not only slide if I wanted to, but in this instance, to attach the cup to create a good seal. So when working on the body, so like let's say her latissimus muscle, her back area is really tight and I can feel it with my hands. Therefore, which is why I want to use a cup. I'm using just this manual pump gun set just for one to show you the ease and the control and what I'm doing. So rather than just put it on with strong suction, sometimes people can twitch and wince and it can be too intense. It already gets red, right? So putting a stationary cup on, most people are totally great with it, but remember, not everyone's the same. Hydration, experience with body work, tension, all the things to consider, right? Instead of just a stationary cup, when you do this lift, and you let it go. So the lift and release, I'll put it on, you see I lift it and I release it and I take it off. When you put this lift and you take it off, what you're doing is in a muscular world, we're actually stimulating the Golgi tendon organ, the receptor in the muscle that initiates the relaxation. So a lot of times these hypertonic muscles, if you put a stationary cup on, they're gonna block you. It's just like having too much pressure with a massage, okay? So when you do this lift and release, and now you see she's so tight, I can't lift it but so far, but it's rather than just putting it on, physically lift it away, release the tension and take it off. So maybe I do that all the way down her back because I want to slide the cup. And rather than try and slide it, which I probably could, but what if I try and slide it and it's uncomfortable for her? I'll do this lift and release. Remember, it's good for general regions or one specific point. When I do this lift and release along the line of movement I want to attempt to move, now I can pick it up and it moves with ease. If I find a restriction, which is ironically where I first started because my hand found her tension knot, I can do the lift and release and I can keep moving along that line of movement. And as I go back and forth, it gets softer, and where it's stuck, I can just do that lift and release and keep melting the muscle, okay? Every time it gets stuck. Now, maybe it gets stuck over the kidney region. I'm not trying to overstimulate the kidneys or adrenal glands, but that lift and release really allows things to soften up quickly. And of course, most importantly, their comfort is more welcome. Model, how's this feeling?
Amazing.
Amazing, in case you can't hear her. And in case you can't see it, I have a good medium suction pressure on her. It's not light, but you see how much easier it's moving now? So that lift and release facilitates that change. And if you can see, she's getting nice and pink, but that lift and release allows me to make this moving cup move easier, and my hand isn't working as hard, and now I can move it smoother and faster. Or maybe I want to go over her scapula, and because it's a bone, it's not easy to slide it. So she's got a tight shoulder. This lift and release allows me to bring the benefit of cups. Maybe she's sensitive and she's a little, hesitant of having cupping marks. This lift and release allows for that enhanced fluid exchange, releases the tension in the muscle. She feels the benefit all without that stationary cup. And of course, there's a little adhesion, but we'll talk about that later. So working through these regions, if you can't slide it, lift and release around. Client, how does this feel over your shoulder?
I need it.
She needs it. So there's all these ways to really use this technique like an extension of your hand, but it has so much more potential, okay? So that is for muscular. We're gonna come back to her back in just a moment, but to keep going on with some more content, let me bring this over here for you. Going on to the next slide, because I want to talk about the nervous system. So think about the nervous system now. It's woven through every layer of our bodies, up to the skin, into the spinal cord, everything in between, all the nerves everywhere. Lift and release is such a great introduction for cupping for so many different ailments, pathologies. Think about people with lighter pressure sensitivities. One of my favorite examples to discuss and help people really understand the true potential of cupping and this manner is talking about clients with fibromyalgia. There's an article that I, in my research, came across. It's in my book, and there's a reference item at the end of the webinar. How some people suffering from fibromyalgia actually have a higher concentration of sensory nerve endings around the capillaries in their skin, which lead to pressure. Any disturbance in the pressure initiates pain reception within their whole bodies, which is why so many people with fibromyalgia, light sensitivity, respond so well to the lift and release with light pressure. So oftentimes we'll meet people with lift and release their first session, and that's all we'll do, in very light suction with these people that are hypersensitive for whatever reason. And then the next session, they can either take more pressure or they just feel great. The feedback has always been positive if you stick to these rules and guidelines that we give you, because we've done it for so many years and had thousands of students that have the same feedback around the world. So there is a logical way to get into a nervous system reaction. That's lighter. But now going back to a deeper aspect on the model again, a lot of people are familiar with, oh shoot, thanks Jeffrey. I'll let you do it. A lot of people are familiar with cups alongside either side of the spine. In Chinese medicine, they are vital points to address the entire body and try and affect the harmony, the homeostasis, if you will. So it's alongside either side of the spine. But what you see is, or first of all, what you'll hear is people say, oh, cupping was painful, but I was told that's what I had to feel like. Cups should never be painful. Please don't let everyone tell you that. They can feel therapeutically beneficial, which is kind of what I like to say, and my students take it away from us. And I love that saying because our clients know, you all know what pain is and what therapeutic benefit is, right? Teetering on that edge. So if you're trying to put these stationary cups alongside the spine, and you want to do this lift and release, right? Now, people are familiar with these stationary cups, and if you do multiple cups, that flash cupping for pulmonary conditions, that's another subject. Again, we talk about pulmonary conditions in detail. But flash cupping is multiple cups done in rounds. This way, we're doing it with one cup. And so when we say with one cup, we keep you focused. We allow people, maybe you're addressing a central nervous condition of stress or chronic fatigue, and you get too strong with the cup, it's kind of negating the relaxing purpose, right? But then maybe you progress into something more complicated like multiple sclerosis, even Parkinson's disease we talk about. And using this application, cups alongside either side of the spine does have an indirect effect on the central nervous system by affecting the peripheral nervous system, breaking that loop of tension, right? So you can do this lift and release and then put the stationary cup down, right? You don't have to just go right to the stationary cup. Do the lift and release 1 or 2 times and then put it on. Because why bother potentially hurting somebody when you can just automatically make it feel good, right? That lift and release is so crucial to grasp when you really get into the kind of body work that we take our students to, that our clients are, knowing what we're doing. It's this lift and release. It really does change how people receive cupping in their body. So it's not just one cup placement fits all. Maybe someone is so sensitive that I can't do any stationary cups, right? Maybe you're working with a senior citizen whose tissue is fragile, or you're working with a juvenile kid. We work with infants. One of my clients is 96. Everyone can receive cups. It's just about understanding who you're working on, how their tissue responds, and working appropriately. So if you want to work with these central nervous conditions, right, and you start to work alongside the spine, keep it simple, keep it with what you might already know, right? If this is enough and you're familiar with putting cups down the spine, maybe you do the lift and release, and everywhere you want to do a stationary cup, you do a lift and release 1 time. We often, in our classes, we start with a stationary cup, and people will say, ooh, yeah, that's a sensation. Then we get them progressing to the lift and release, and we say, hey guys, just try the lift and release 1 or 2 times and then put the stationary cup down. The person receiving it was like, yeah, that feels better. And they're able to take more suction more comfortably. And that's a huge benefit in and of itself, okay? So taking all these cups off, we have one more thing to show you, but I'm gonna come over there and have a conversation, let my model make her way around. So just give me one moment. So working with central nervous system conditions, working with the pain in the skin, all different nervous system involvements. Khadijah, you can go ahead and, excuse me, model, go ahead and turn over for me, please. So now lastly, but absolutely not least, this application, this technique to work in the abdomen is crucial. So we see all different things with cups all over the world. I see some amazing things. I see some things that make me take a moment and just kind of observe that, everyone has their way with cups. But working in the abdomen, there's a lot to consider, from the fact that the specialized adipose in the abdomen, the funiculus adipose, because it can become easily inflamed, and any aggressive cupping in there, maybe people that do it for cellulite, there's also visceral organs to acknowledge, right? And you have to know your anatomy. So when you work in the large intestines, so for like constipation, for example, okay? So working along the colon, if you think about, are you draped and all set? Thank you. Thank you. So if you think about the colon itself, the anatomy of the organ, the haustra pockets, every segment of the colon, the pockets are rounded, and the cup, the natural shape, enhances the pockets, and the smooth muscle that wraps around the organ to stimulate that peristalsis responds so good to this lift and release, which can even progress to a moving cup around the colon comfortably and more beneficially. So to work in the abdomen with comfort and with the utmost benefit, especially working around the colon's pathway, when you get into working in the stomach, a lot of times people press in, and if you're constipated, you don't want to press in the stomach. It's not going to be comfortable. So this negative pressure is welcome. And every time you meet someone who's a little hesitant about it, when they feel it, they love it. So for example, if we're working just at the utmost exit point of the colon, putting it here, lift and let it go, okay? As we progress around the colon, I'm gonna do this sigmoid section and work in the clockwise manner to stimulate that peristalsis to the exit point, right? I can do that a couple times, and then I can progress down the descending colon. And you see how I'm physically lifting it away? Because when you lift, the effect is felt deeper without that strong suction that could potentially cause damage in the abdomen. So lift, woo, slippery sometimes. Lift, release, take it off. Lift, release, take it off. Very rhythmic, very methodical, like peristalsis, right? Make this feel good. Anyone suffering from abdominal dysfunction of the colon, this is a game changer also. Now, if you consider people that might have foreign objects in their stomach, if you consider people who might have, let's say, foreign objects in their stomach, you can't do that same work, right? But there are adaptations of that technique that you are welcome to do. Or perhaps someone has emotional sensitivities in the stomach. It is the core of our bodies. And so anything strong, cups are beautiful, but make sure they're comfortable for the person. So lighter suction in the stomach still gets that lifting effect, right? But that stretch, that lift allows it to go deeper. And this is when Ilke Chirali mentioned 4 inches into human anatomy. If you put that together with the comfort of the suction, the logic of the lift, and the awareness of the anatomy, that is a beautiful thing to offer people. If you haven't used cups in that manner before, perhaps consider doing it now. So in summary, for all of that information, the lift and release truly is a wonderfully simple yet profoundly effective technique that we encourage you all to add into your existing cupping practices. It really is that notable in difference and enhancement. But regardless of the pressure, it benefits the cupping world. Whatever your knowledge is and your experience, I've had students who've been doing cups for 20 years. They learn that one technique, they're like, wow, it just changes everything. But ultimately, in the end, lift and release does help to maximize the therapeutic responses of many cupping applications, and ultimately ensures that the comfort and safety of the client is prioritized so that everyone can enjoy the benefits of cupping bodywork. And if you're like me, I love cups, and this technique changes it all. So I hope you have a great takeaway from it. If you liked what I talked about just now and you're piqued for more information, we have a slide here at the end that has our website that lists our international courses. And we have contact information. If you're a social media person, feel free to follow us. There's that there. And we are approved for continuing education in many different professions. If we're not approved provider for your profession, like physical therapists, we do state-by-state requirements. You can email us. We take chiropractors, doctors, estheticians. If you do body work and you want to learn cups, we hope to see you in a class someday. And I thank you all for your time tonight, and I welcome your questions.
Well, that was amazing. So thank you so much. And thank you to our wonderful demo model, which I am super jealous. I wish I was the demo model. So next time you're coming here. But without further ado, let's get into the questions because there's actually a bunch of them.
Okay.
So the first question is, in the thermography slide, what is the time lapse and consultation time from each scan?
Yeah, okay, so may I just go back and revisit the numbering?
Course.
Okay, so when I did this, we did have a timestamp, and those thermographic images are actually in my book with the exact timestamps on the photos. But so just let me see these. So the first to second slide was 10 minutes. And then from the 10 minutes to the third picture, I think that was about another 10 minutes. And then we let another 10 minutes recede. So we try to keep it in a little bit of uniform time increments.
Perfect. Next, actually, you actually kind of covered this, but thoughts on this technique for pediatric patients?
Yeah, so we work with infants, and the biggest thing is I actually wrote a really in-depth article for Massage Magazine on working with kids in cups as well as geriatric with cups. So there's a couple things to consider is the fact that like their tissue is more fragile and developing as they're younger, they can mark easier. So we use lighter suction with the younger the person is. And it's no problem. I've used them on 6-month-old infants with colic, and I use the face cups. I use that one on babies. It controls the suction.
Wonderful. Next question is, would this help with, I'm probably gonna butcher this, but ascites? It's A-S-C-I-T-E-S. Ascites? Ascites.
Is that's not in sarcus with the swelling. Ascites, I'm not familiar with the term.
It's the accumulation of fluid in the peritoneal cavity causing abdominal swelling.
Oh, okay, I know that as a different term. So it's the thing we say about that is yes, it can help with swelling. However, with the abdominal cavity, people have a lot of different reasons they get such swelling. So it can be some organ failure. And so that would be making sure that someone has medical clearance to receive like lymph drainage. And if that is approved for potential betterment, then yeah, this can be used, but this never takes place of medical care. So if people can receive hands work to move lymph, yes, they can use this, but always check with someone's medical care professional and see what's exactly causing that.
All right. Now the next question is actually about the cups themselves, which at least from what I could tell, it looks like you're using a plastic cupping set with a hand suction pump, pretty similar to some of the options that we sell. So I'm going to throw a link into the chat for anybody who's questioning that. But that's, basically if you want to share a little bit about the cups and why you picked them.
Sure. So yeah, as an educator, it's always interesting when we come across how many cups there are in the world, because as a retailer, you all know how many you can find that want to be sold on your website, right? So for tonight, I used the manual pump gun because it allows, when I'm trying to demonstrate and show you the lifting, I can control the suction a little more with the pump gun and the hose, and it doesn't bother my shoulder with just the pump gun, so I love the hose. You can do it with a silicone cup like I showed you on the face, they just squeeze. And we love the clear silicone ones that you can use just your hand to create the suction. And those actually help you lift it, because the ones that we sell in our company, they have like a groove that your fingers just sit into. So it allows for a better lift, and you can maintain that lift to slide them. I love glass cups, the ones that we sell from Lhasa Ohms. We sell those at every class, not only for the face, but for the body. It doesn't really matter. We teach you, it doesn't matter what cup you use, it's how you use it. And I just showed you two of my favorites. I have a machine, fire isn't legal for massage therapists, but I do it as a party trick if people want to see it. There's so many cups. Just work with what you have. And if you want to try different sets, see what works for you.
That is a great answer. Let's see, we have a lot of questions. And just for anybody who's still watching, if you're putting questions into the chat, I can't go back and forth between questions and chat. So for any chance of me seeing it, please use the questions tab. And we're going to do our best to answer all of the questions if we're able to. Next question is, how often and how many sessions over 5 to 8 month period to achieve the results on that knee patient?
Yeah, that one's pretty awesome. So that one, it was regular. I broke it down. Hold on a second. I'm not even a horrible saleswoman. I'm just pulling out the book for the exact details because I wrote it down. It was regular sessions. And so when we say regular, you never want to do cupping of this nature within 48 hours. So you want 48 hours in between any application for the tissue to fully process and resettle before you keep intervening. So when I worked with that client, it was 8 months that the photo was taken after the surgery. And I started working with her 8 weeks after the surgery because her tissue was too compromised to start earlier. Some conditions, like we talk about in our SCARred class, we can start working on people earlier, but that's not the subject at hand. It took us 8 months to get from the 8-week starting period to the end result that you see. And they were regularly twice a week for the first 5 weeks. And then as time went on and, schedules and finances, we spaced them out to once a week. And at the end, it was like once a month for the last 2 months, incorporated into their massage because she just wanted a massage at that point. So the regularness was intense for 5 weeks, twice a week, and that tapered off to the end result.
Amazing. Does this technique on the face help with Bell's palsy patients?
Absolutely. So we, in the third day of our certification program, when we work on the face, we do an even, universal, balanced both sides, right? But on the fourth day, when we discuss Bell's palsy in more detail, because there can be one side that has that inflammation and, a lot of that congestion where you see that drooping, you always want to start with an even treatment because maybe some of the lymph nodes that are impacted or the nerve that fires into the face is overstimulated. If you work on the affected side too much, you can make things worse. So there is another, again, it's cumulative, right? So we have amazing results. I have wild photos and all these testimonials about Bell's palsy reactions, but it's cumulative and you do want to have some higher training like we do on our courses. Mm-hmm.
All right, next question I will answer. Will there be a recording of this available afterwards? And the answer is yes. So all of you can either stay on this page after we end, and if you missed anything, you can just start watching right away. Also, everyone will receive an email about 5 minutes after we end, and that will include a link to watch the video on demand and also a link to download the slides. So that was an easy one. Next question will be for you. How much suction is one using during lift and release when working lymphatic pathways? Is the goal the same as with Vater? I'm not sure if you know what Vater is.
Yeah, Vater. Okay, so highly trained therapist. I love it. So there's different schools of lymph drainage, and Vater is one technique that is world-renowned and beautiful. So with a true manual lymph drainage, you want to create no hyperemia. And so with the cups that I use tonight, it's really not possible to do exactly the same. However, so many Vater therapists that come to our classes love this because not only will they use a cup to address some of the restrictions along the route that you're working. Maybe you encounter a scar or an area that is more obstructed, but there are machines that have that regulated lighter suction if you want to make that investment after you get adequate training that can mimic that true lightest Vater-like technique, but nothing will ever replace your beautiful hands. So use the cups in combination with your hands. And that's what all the MLD therapists that come to our classes take home with this. They will never let go of their hands. We never tell you to, but fuse it together and you will see how awesome this just enhances what you already do.
All right. And the next question was in regards to how long were the sessions when you worked on the person's feet?
Yeah. So that was one session. Those pictures, that was one session.
How long was the session itself?
Oh, 1 hour.
Okay.
I addressed her whole lower extremity. We had to get into the abdomen and up to the chest to get, the full lymphatic circuit stimulated. But the focus, the foot was probably, I think, 10, 15 minutes. It was 1 hour from start to finish. And you never overdo it. There's indications when you're done with cupping that we really drive into our students. Everything from if the tissue changes in temperature, if the client reports a little hypersensitivity, if you've seen the results you're going for, maybe they're getting cupping marks. These are all indications you're done. That client, the colors were changing in her skin. The reddening was happening around the area, and the blood was lightening. That stagnant blood was lightening immediately. And so then her body continued to process that 5 hours later, which is why that picture is so awesome. I had no idea she did it, but I love that she did.
You're not going to complain. So how are you doing on time? Because we still have a bunch of questions, and I would love to keep asking them if you're able.
I'm happy. Yeah, I'm happy to answer. I think I welcome questions.
Well, thank you to the attendees, because there are great questions here.
Thank you.
So next question is, would you use lift and release over the spine, say if somebody has a rib that's out?
Absolutely. So we teach a lot of chiropractors. However, there's so many contraindications to consider, and the client that you're working on. If there is a subluxation versus a herniation versus a bulge, herniations and bulges, I'm not working on a massage therapist. Subluxations, vast majority of the population has something that's awry in the spine, right? We always suggest, regardless of your training, that you work alongside either side of the spine to relax the muscles first. And if you want to work on the spine, lift and release is a great way to test. However, use your fingers first to see if any specific location is sensitive to your fingers. And if that's where you want to work, I would suggest you work around the region. And if it isn't painful, but they're sensitive, the lightest suction really does address that whole region. We teach a lot of chiropractors. We even talk about like ankylosing spondylitis and spondylolisthesis in our courses, working on the vertebral column itself. Working within your scope of practice is crucial, but you totally can, as long as it's not contraindicated and especially not painful.
All right. Next question is, what is your method or principle for working with men who might have a little bit more body hair to maintain the suction?
So that's a great question. And the funny thing is I had two models tonight. One was covered in body hair, but wasn't comfortable being my model. So you can use lift and release. I've had one client in my life who had so much body hair, I couldn't get a cup on him. And, but I know people that cup animals with soap and lotion. So with men with excessive body hair, you probably want to have more than just oil. A lotion oil combination is a really good idea to get that extra seal. And you might need a little stronger suction to make it attach, because the hair breaks the seal of the skin. But if you're dealing with someone hypersensitive and there's hair, then I just wouldn't use cups. However, of course, this is why I talk about this for so many hours a day, right? Because we go every direction. Like Jeffrey, you have a great beard, right? So if I want to work on a beard and I can't use a cup and I can't, I want to get the face work doing it, pinching the skin gets that same lift. So I'll pinch your beard and just follow the drainage pathways. We do it in every class with every man who doesn't want to shave. So you can combine the cups where you can put them and the hands where you can't. We do hair pulls too, right? And then we have bald clients. We have everyone.
Love it. Love it. All right, keep going. Can you do lift and release with fire cupping, or plastic suction cups and silicone cups are more efficient?
So fire cupping is not really a viable option, because A, the flame is ignited for a long time and that's hazardous. But B, it's a lot of like stamping down on the person, and then with that heat, it can get too hot for the skin. So fire cups are kind of an exception where it's not the greatest idea. But maybe you do like a 1-2 and then put it down so it doesn't get the rim of the cup too hot. The silicone cups, again, I love those for this lift and release, because my hands are pretty strong after 20-something years of body work, but I also didn't take them tonight because they can be a little fatiguing. In our classes, you're doing an hour and a half of body work a day, more or less. And so people with this squeezing, they're like, oh my gosh, their hands get so tired. You can do it. You won't ever do it for that long in your practice, but just get used to the mechanism and make sure that your comfort is of the utmost importance also, right?
Yeah, actually the next question pretty much kind of follows up on like what you're talking about, which is,
Mhm.
you know, it kind of looks like that it's an opportunity because this person normally does fire cups, and they're saying that it looks like this is an opportunity to flare up old wrist and forearm injuries and inflammation.
Yeah. Yeah, and I mean, you know, to that point, what's the saying? We work smarter, not harder. Please understand, like as a body worker, I do self-care all day. So if you're someone who works with these cups like we do, I'll go into my office in between classes. I see 7, 8 clients a day sometimes, which isn't ideal, but you know, I try and please everybody. But we can work on our own wrists, even working in the hand with this lift and release to soften up those tired little thenar eminences, and then maybe leaving the stationary cup on there and doing a little wiggle. So initiate some self-care. It can flare up wrist issues, but also make sure you're taking care of yourselves.
Okay, and then can you use this on somebody who had a fundoplication?
Fundoplication, I'm not sure what that is.
Surgical procedure to help treat stomach and acid reflux.
Oh yeah, so we actually, we have an application in our pathology course that addresses acid reflux, which is a lift and release with a little more, right? There's more, what's it called? Like tactile perception and knowledge of the anatomy, working towards that tonic muscle and kind of improving the tone of the sphincter. And you have to follow the organ's anatomy, and you have to do a little more manipulation. So lift and release is a great way to start. But if people have foreign objects in the stomach, remember things like even lap band surgeries, or if someone has a higher grade hiatal hernia that's causing this dysfunction, you don't want to work with a cup in there because they, you know, alleviate adhesions, and we can dislodge foreign objects. So if it's just like scar tissue internally, I would say lift and release is a great way to start. But if you really want to get into that, please come to one of our classes and really get into the body work, because it does take a little more finesse.
All right, and next question is, when do you use the extension tube, and when do you attach the cup directly to the pump?
Great question. So a lot of times with this lovely equipment, so the hose is actually made, believe it or not, for like, see if I can do it right now because I'm a little, my flexibility. So the hose is made for like self-care, right?
Exactly.
So like, how high can I get this cup? The hose is great for that. Maybe I'm working on like my glutes or my legs or my feet. The hose is great for moving around and not hurting my shoulders trying to get there, or maybe my low back, right? But then I love, if you get into stationary cups especially, the point and shoot is my favorite. And like you saw when I was working down her back, I did the lift and release with just the pump gun without the hose, because I knew I was going to do 1, 2, and then leave the cup, and I was going to get another cup. And I don't want to futz around with the hose too much. So it's about getting comfortable with the equipment in addition to the theory and the techniques that you're learning. It's a lot, but you know, it's pretty easy once you get a handle on what we're doing.
And actually, while we have your video screen enlarged, can you also, the next question is, how did you do the releasing of the suction without pulling on the valve itself? I also was wondering the same thing.
That is such a wonderful question that we get every time in our classes. And it's hilarious because people are always watching our face and they're not watching our hands. So the way that we do this, I'll show you this. So considering also, I'm gonna add in a bit of history, which is why we release it the way we do. So cups have been known throughout time in some cultures to expel evil spirits. And I had a student in a class, there were 2 athletic trainers who came for muscle work. They just wanted muscle work, but they kept opening the cup towards them. And all of a sudden there was a major energy exchange, emotional reactions, and both of them, the person doing it and the person receiving it, had emotional reactions. So we talked about that, but that's a different subject, right? So you always want to get used to opening the cup away from you. And so to do that, I have to maintain a grip on the cup. So I at least need 1, if not 2 fingers, which leaves my latter 2 friends available to just tip the cup away from me and break the seal of the skin with my finger, not digging my fingernail into the client. So it's the cup's on the skin, tip the cup away from you, simultaneously press into the skin with your finger, either finger of choice.
So interesting. I was wondering the whole time because I was actually watching your hands and I still couldn't see that that was what you were doing. So I was like really hoping someone asked that question. So thank you.
It's kind of like the where's the walnut thing when you're watching people do that trick. People can't see my finger do it, and we slow down in class and make sure every table gets it before they go on.
Love it. And then somebody asked what cups did you use on the face, and it was the silicone cups, correct?
Yeah, this is a great set. They're a silicone pitcher set. There's this one size, and there's one that's even smaller, which is fabulous for around the eyes. And there's a specialized way to work around the small, delicate, thinnest tissue of the eye, where it's the lift and release without the added lift. And that's important to acknowledge when you're working in the delicate tissue. So people aren't adding bags to their eyes. They're actually toning the tissue. It mimics this of your fingers, but with the benefit of the cup, the lightest suction, hardly any lift.
Amazing. For digestive problems, do you cup only the left side of abdomen, descending and sigmoid colon?
We do the whole colon in a logical clockwise progression, but for demonstration purposes tonight and timing, I didn't do the whole thing. It's a very beautiful, holistic application for the abdominal cavity. We do one section at a time, always working with the anatomy of the colon, and we actually finish at the ileocecal valve and work our way around. Right? So there's a logical sectional progression, multiple passes, very stimulating and very rewarding.
And then what are your thoughts on the strong pumping device machine? So like this person mentioned one called Bujang, but I'm sure there's 100 different brands.
There's so many cups out there. We always tell our students, we're like, hey, we have a couple of sets. We're here to teach you. We'll sell you some stuff, but go out there and see what you like for cupping. There's so many cupping machines. I'm not familiar with that in particular. I own a machine because just like we had that Vauder therapist asked about the lighter applications, I think machines are great for a couple reasons. One, it saves your hand the squeezing, right? And it gets you that suction. Two, it allows for regulated results, like cumulative, measurable, evidential results. So like if I had 5 micrograms of pressure in the first session and they had good results, I can increase it to 7, 10, 15 accordingly. Or maybe it's the thicker dermis of the feet that I'm working on, that the manual pump gun could be frustrated. You can crank that machine up and get a foot. They also have, some of those machines have those larger cups that you see like gluteal enhancement and stuff. We use those. And they're great for not only the gluteal muscles, but we also, certain scope of practices, and depending on your training, we work over breast tissue, everything from like mastectomy reconstructions or surgical rehabilitation. The machines are great for the control and the ease of function, but they're just costly. So if you're gonna invest in this like we do, might as well go for it. But remember, the power goes out. So always have manual equipment, because I've been mid-session when the power goes out. You don't want to be that person.
Is cupping safe to do on pregnant women?
Excuse me. Yes. Excuse me for a second.
Yes, of course.
Dry heat and lots of talking.
Yes, not a great combo.
Excuse me. So yes, it is, but with a lot of control and safety. I talk about it a little in the book. There are things to acknowledge about what cups do, like changing fluid levels and breaking up adhesions in the regions of the body you might want to work on, and the fact that there's relaxin hormone that can stretch ligaments and you can cause damage while it's relaxed while they're pregnant. So I'm not going to really go too much into detail right now, but please understand, not only is there great safe ways to work on pregnant women, but we are working towards an advanced elective course of prenatal postpartum, hopefully in 23 and 24. We talk about it in our fundamentals a little because people want to understand how to work with prenatal clients. It is beautiful, but it does need attention to detail. And that I could talk about right here for about 20 minutes.
All right, that'll be the next webinar.
Okay, yeah, there you go, perfect.
Let's see. Let's just do a couple more questions. There's a ton, and they're just going to keep coming in. And we don't want to keep everybody here all night. I'm sure people want to get some dinner. Let's see. There's actually a couple questions about this. So what are your opinions on how to properly disinfect plastic and silicone cups?
Yeah, that's a big thing to keep in mind now, especially with the cupping world and all the changes we've had in the last couple of years. So silicone and plastic, they're porous. So there are a couple different disinfecting solutions that we've worked with. And, I'm an international educator, so every country has different requirements. Every state has different requirements, and every professional office has different requirements. I teach in hospitals, I teach in massage clinics and spas. So for those two, you always, first of all, every cup that you ever use, you want to wash in soap and water immediately after usage. Never use it twice on different clients, excuse me. But after they're washed and rinsed, you can have these approved disinfectants that you can spray the cups down. Some of them, the ones in our office, it's a spray disinfectant, and then they air dry, and that is safe for direct skin usage, and it is approved for silicone and plastic. I know some therapists that love the UV sterilizers. If you're someone who works with those are great. I know rubbing alcohol has worked in the past, but right now the CDC requirements in the US especially are higher. So washing them in soap and water, using an approved disinfectant, and air drying, they are good to go for skin contact after they're dry.
All right, let's do one more question. Let's see. You speak of hyperemia benefit. If the blood is empty, didn't eat, or dirty, ate junk food, then improving circulation is not as great as when blood is saturated with nutrients, is it? I have my patients eat at least 5 healthy meals before coming in or drink essential amino acids.
Well, that's beautiful. And I love that for caring, like having the clients that come in that will do that work on the front side. That's more into the Chinese medicine world. And so that is that whole tonifying aspect before you start using the cups, which is awesome. And that is absolutely correct. The hyperemic aspect, that I look at that as a universal understanding of fluid movement, regardless of your background as a body worker. Because when we talk about the chi and the stagnation and deficiency and a lack and absence of circulation and energy, the depletion, you are getting them replenished on the front side before they come in for cupping. A lot of times people are coming into these cupping classes or training and they don't know anything of Chinese medicine, but they want to use cups and they're doing more harm than good. So at that point, we do leave it up to encouraging hydration. And when I mentioned a couple times, knowing your clients, their experience with body work, how they respond to it, their hydration, their nutritional background is, it's absolutely crucial. We've put cups on people, lift and release, stationary, all these angular applications that get no coloring. And that is, an indication of depleted energy, depleted blood, whatever your language is. Yes, that makes sense. Mm-hmm.
All right, and then actually, how about one more question?
Sure.
How about using this for people suffering with neuropathy?
Oh, it's fabulous. Yeah. So we talk about even specifically diabetic neuropathy, that positive pressure trying to work in hands and feet, or someone that's recovering from like surgical neuropathy, because it's so hyperstimulated and easily irritated. Just like I mentioned with the fibromyalgia, that light negative pressure, lift and release for neuropathy is a great way to approach it, because all you got to do is touch the skin and engage the suction, and they do welcome this. There are sometimes people are still hypersensitive regardless. Respect it and don't do it.
Shannon, we cannot thank you enough for this incredible webinar. I mean, we didn't get to all the questions. There were so many great ones. Thank you to all of our attendees. I will announce this is actually our last webinar of 2021. So thank you for helping us end a fantastic year with almost 30 webinars. Really fantastic. Our next webinar is going to be happening on January the 4th, and it will be neuroacupuncture for treating difficult neurological disorders, featuring Dr. Jason Howe. So please attend then. I hope everyone has a wonderful holiday season, a happy new year, and we will see you in 2022.
Thank you, Jeffrey. Thank you, Lassa Ohms. Thank you, everyone out there. I hope you have a great takeaway. And thank you for your time. Happy holidays. Everyone stay safe and stay healthy, and take care. See you all later.
You too. And everybody check out moderncuppingtherapy.com. The link is in the chat. You'll also get a link in your email in just a minute. All right, good night, everybody.
Thanks, guys.
Thank you.
Good night.